So hello everyone, this is Krishna from Women Today YouTube channel. So in this channel, we have been interviewing many women entrepreneurs and working women across different cities in India. We are just traveling directly to the office locations in different cities in India, and we are just doing offline interviews, and we are also doing online interviews across different cities in India and also across different countries in the world. So today's our guest is from Delhi, Noida. Her name is Dr. Sakshi Chopra, a gynecologist and also an IVF specialist. So I welcome you, Dr. Sakshi Chopra, ma'am, to this Women Today YouTube channel. So please kindly introduce about yourself, about the kind of work that you're doing to the audience who are watching this interview right now, ma'am.
Hi, I am Dr. Sakshi Chopra. I am a gynecologist and an IVF consultant. I am currently working in Delhi as well as in Noida. I have over 10 years of experience in this field, and I'm working with the very closely. I'm working with the couples who have been facing with the infertility and they are not able to achieve their dream of parenthood, as well as I'm giving them the opportunity to go through an easy process of IVF. And throughout their pregnancy also, I'm always being a part of them, and till the delivery, to give them their bundle of joy in their hands. So being a trained obstetrician also, this helps me achieve giving them this dream of their parenthood and giving their little bundle of joy in their hands. So that is the best part of my field.
Of course, you're doing a very wonderful job because each and every life born in this world starts from great professionals like you. You are helping the new life to begin. That's a great, wonderful introduction from you, ma'am.
Yes.
So,
Yes.
also you have mentioned
From creating a small human being.
Exactly. Everything
So
starts from
throughout my IVF, the best part is that we create a small human being and then bring them to this world and then handing over to the parents and completing their journey with us.
That's a great thing, ma'am. So also you are just talking that you're just helping a lot of patients coming to you by just treating them during the pregnancy times. So tell us, ma'am, during the pregnancy times and even before the pregnancy time, what are the main checkups and tests that each and everybody should do so that they can have a very healthy kid, ma'am?
Okay. So normally whenever a couple comes in the preconception periods, generally we advise the couples to come in the preconception period, that is at least 3 to 6 months prior to whenever they are planning a pregnancy. In this phase, we generally evaluate the mother as well as the partner and do some basic simple tests to make sure that both are fit and fine so that they can help in making a healthy baby, so that they have a healthy baby. So in terms of the lady, generally we go through simple blood tests like checking their hemoglobins, their thyroid levels, their sugar levels, and the one test which we normally check is the AMH level. That is the egg reserve. It's an egg reserve test to make sure that the number of eggs are fine and within the normal range, so that we can give them the guidance that how you should plan your pregnancy, how should plan this. And then in terms of the male partner, we generally go through a semen analysis test to see the sperm quality and the sperm count. And in this preconception phase, the one supplement we have to give to the mothers is the folic acid supplement. Now, the main important of this supplement is that it prevents from the neural tube defects, that is the defects of the brain as well as the spinal cord in the baby. So this is one of the essential thing which we recommend to all the women who are planning to become mother in near future.
So also tell us, ma'am, so consider any athlete, they're going to go and participate in any match like sports. Consider any astronauts, they're going for space, they should make sure that they're in a very healthy body. So in the same way, each and every department requires a proper health checkup and proper maintenance of the body. So tell us, ma'am, for women during these kind of pregnancy periods, how should they actually maintain their body and how should they prepare themselves for the baby to be like conceived in a very good way? So tell us how to prepare the body for women during pregnancy periods, ma'am.
So during this period, in the preconception period, generally we say that you should have a very balanced and a healthy nutritious diet, so that what you are eating you will be giving to your next generation. Second thing is, just start doing some exercise, have an active lifestyle. Don't have a sedentary lifestyle, because this will only cause you in gaining weight, and that has very poor bad impact on your fertility also. So have a balanced diet, do some exercise, avoid junk and the processed food which is not at all healthy. Then be have a very just have a good emotional support with your partner. It is always the lady who is taking all the pressure on herself during this period, that I have to conceive on time. The pressure is always on the women only. So this, we recommend that it is not you only, that you are only a part of this, that you are creating a next generation. The father as well as gives the equal amount on in this. So just have a proper and a emotional support, have a proper bonding with your husband and with the entire family. The entire family should also support at this point of time.
Yeah.
Okay, so these are the main things I think we should, so that if the mother and the father, they are having a good bond, and if they are in the good situation, then only the next human being will also be healthy.
Exactly. So both the partners should have a good kind of combination. Of course, during the pregnancy
That's
times, of course, physically, if you want to make the baby like healthy, then we should eat only healthy foods. And also at the same time,
yeah,
mental things plays a very vital part. If both the partners, like the
exactly.
male and the female partner, are kind of having a very healthy kind of relationships, like kind of supporting each and every other in
Yeah,
each and every stage during pregnancy, then that kind of mental things will be again passed to the child, and they'll be having a very good future. So on the other hand,
exactly,
mental health and also the physical health, both are very important. i do
exactly,
i do understand right now, ma'am. So yeah, also tell
exactly.
us, ma'am.
Yeah,
So many people will be having PCOS and thyroid and many kind of conditions. So during pregnancy times, tell us how
yes.
can we manage these kind of PCOS and thyroid kind of things and other kind of conditions, ma'am.
Okay. So nowadays, PCOS and thyroid disorders have become very common. The reason behind this, because we have a very sedentary lifestyle. We are very much stick to our screens. We are eating most of the processed and the junk foods. And these all condition will cause you in gaining weight. So when you keep on gaining weight, you will start having hormonal imbalance. And these hormonal imbalance will cause PCOS and thyroid disorders. Now, what actually is PCOS? PCOS is a polycystic ovarian syndrome, in which the main problem is that you do not ovulate. The women do not ovulate. There is anovulation, and that is the reason they start having irregular cycles. And this will definitely will impact their fertility. So the one thing which we tell to all the PCOS women is that once you will change your lifestyle and have a very active lifestyle, like you will start if you will daily, you will start doing the exercise, like at least 30 minutes to a 45 minutes regime. If you will start in terms of whatever which you are comfortable, like you start with walking, you can do some light yoga, and then you can do some gyms and all. And second, have a balanced and a healthy home cooked food. If you start eating that, your PCOS will automatically can reverse, and this will help in your cycles as well as in your fertility also. Similarly, in thyroids also, if you have thyroids, then the best is we start giving the supplements, because thyroid can have a bad impact on the fetus also, on the baby also. So if the mother's thyroid levels should be well controlled, then only the fetus will be healthy, because in if the thyroids are not controlled, especially in the first trimester of the pregnancy, there are higher chances that the baby can have mental retardation. So that is very important. So in the preconceptional period, that is why we check all the hormones to make sure that we can give them the correct treatment at the right time. and then they plan pregnancy in a healthy way.
Yeah, now I understand that basically we need physical activity, of course, not to a
Exactly.
highest level, but to a minimum level in order
Yeah.
to face these kind of
Whatever suits to whichever person. We say not everyone should go to gym, spend lots of money, and then start the exercise, and then only you will be able to lose weight. No, it is not that. Even at home also you can do some yoga and exercise, and that will also help in controlling your hormonal imbalance.
Yeah, as you mentioned during the thyroid kind of problems, hormonal imbalance, like it affects a lot. So as you told, when you follow the procedures that you tell to the people, so I think it will be in a very maintained situation, like I understand right now.
Yeah,
So
exactly.
also many people will be wondering, like there should be any kind of ideal age for pregnancy, and they'll be wondering like what is the ideal age for pregnancy, and also at the same time, how does this age affect the fertility, ma'am? So tell us all about it, ma'am.
Okay. So the fertility is best during your 20s and early 30s. Normally, we say if you are planning pregnancy, better is to plan as early as possible before you become old. And so now the criteria for that age has become that if you are above 35, your fertility will decline. Okay, so the best time for your fertility and for your conception in which you may not require any form of advanced treatment is in your early 20s. Once you will hit your 30s and that to above 35, your egg number, that is a quantity, as well as your quality decline. And that can cause genetic issues in the next generation or in your pregnancies. So that is why above 35 there are higher chances that you may require some kind of treatment, or there could be some issues in your fertility, and there could be some problems in your pregnancies also. So better if you are married and if you are planning pregnancy, so it should be as early in your 20s, that will give you best results.
So yeah, I understand. So each and everything should be done at the right time so that we can gain the best results. Yeah, I do understand.
Exactly.
So also tell us, ma'am, we were just
Best.
talking about the thyroid problems and also other kind of problems. So tell us, if a person is suffering with gestational diabetes or hypertension during this kind of pregnancy periods, how can they actually manage this gestational diabetes or hypertension? So tell us all about it, ma'am.
Okay. Now, gestational diabetes means you have pregnancy-induced diabetes. Normally, this is detected if your diabetes has been detected above 20 weeks of pregnancy, then we call it as gestational diabetes. So, depending upon your sugars level, which we check through a test called OGTT, which is oral glucose tolerance test, in which we give you a glucose load of 75 gram, and then we check your sugar levels. And depending upon your sugar values, we decide your treatment. So if your sugar levels are not very high, then normally in the first stage we tell you to have a medical nutrition therapy, which means change your diet, avoid all kinds of sugar items, and start doing some exercise. Okay. So in terms of exercise, for in pregnant ladies, we generally recommend start doing first walking. Go for some walking, go do some stretchings, yogas, light yogas, depending on your pregnancy, if there is no complication. So the first step in treating your gestational diabetes is through your changing your lifestyle and changing your eating habits. If your sugars become controlled on this, then throughout the pregnancy, you have to follow your strict diet. We even consult you with a dietitian and an endocrinologist to make sure that we are not missing out on any early complications from these gestational diabetes. If your sugars are not controlled or if they are very high in the beginning only, then we add supplements in the form of oral medicines like metformin, which is safe in pregnancy, or we can switch to injectable forms like insulin. So this all depends upon the sugar levels and how they are being controlled throughout the pregnancy. So the gestational diabetes can be easily managed in the pregnancy, and we have to make sure that, because the complications of gestational diabetes can have a bad impact on the fetus also. So these conditions has to be controlled well on time. And second is the hypertension. The gestational hypertension means you have your BPs are starting shooting above 20 weeks of gestation. In this condition also, we make sure that the women should have a salt restricted diet, and she should avoid all junk and processed food during the pregnancy. And we give them some anti-hyper supplements which are safe in pregnancy, like labetalol, which is the safest drug which we can give. And throughout the pregnancy, she has to monitor her BPs. In case anytime the BPs are very high, then we need to make decision on the pregnancy, and we have to make sure that the baby is also doing fine through ultrasounds and color Dopplers, so that the blood flow to the baby are not affected due to these conditions. So both the conditions can be manageable, but these pregnancy becomes little high risk when the pregnancies when they have this diabetes or hypertension.
Yeah, anyways, I do understand with the proper consultation of a doctor like you, so they'll be able to control each and everything. It's not like it cannot be controlled, so it can be controlled with the help of proper guidance and precautions. I do understand.
Yeah, so that is why regular antenatal visits are mandatory in pregnancies.
Yeah, I do understand. So as you told, like regular visits are very important. People always will be worried about how to actually, for each and every month during pregnancy period, they'll be worried about how to actually monitor the baby's growth, also the baby's health. So tell us, what is the right way and how can we actually monitor the baby's growth and its health, ma'am?
Okay, so normally when we call the patients for the antenatal visit, through clinically also we check the baby's growth by checking their abdomen. Then we check the fetal heart rates during each and every visit. We make sure that the mother is also perceiving the fetal movements well. In case she feels that her fetal movements have reduced, we do further tests to make sure that the baby is doing all fine inside the uterus. Second thing, there are regular ultrasounds at particular gestation, which we do to make sure that the baby's weight, the baby is growing according to the gestational age. Then the blood flow to the baby is all fine, because this will help in the fetus growth. So, and in the third trimester, there is a test which we generally do in the 8th and the 9th month, which is called an NST, which is a non-stress test. It is like a graph of the heartbeat of the baby. It is like an ECG of the baby. This graph also tells us about how the fetus is doing well inside or not. And these are all the factors which help in making the decision, so that we can make a timely decision about the delivery. So these are the way in which we keep a monitoring on the fetus.
That's a great way to actually make sure that our baby is in a very right condition. So also people will be like thinking what to do if we have to control certain things. They should be intaking many supplements. They should be intaking many medications. So tell us anything like how should we actually kind of prepared, and can we continue with these medications or supplements, or we should actually stop during this kind of pregnancy times? Tell us about it, ma'am.
Okay. Now, not all medications are safe in pregnancy. So we need to, if a woman is taking some medication prior to the pregnancy, we have to make sure that only the pregnancy safe medication can be continued. The rest we can substitute with the pregnancy safe alternatives. So apart from these, the supplements which we give during the pregnancy, and which is like a necessity for the fetus as well as for the mother, are the iron supplements, the calcium supplements, and the folic acid supplements. These are supplements that she has to take. Fourth thing is, normally our population is very poor is deficient in vitamin D supplements. So now we have started giving the vitamin D supplements apart from the calcium supplements. So these are the regular supplements which we give Rest of the medication, if she's anything she's taking in the before the pregnancy, that we need to check and decide whether she can continue or not.
So also when taking these kind of medications or supplements, certain people will have some kind of infections, allergies, and other health issues. So tell us, how can we handle these kind of allergies while taking some kind of medications, or anything we have uncontrolled in our hands? So tell us about it now.
So any infection or any allergy, that has to be treated during pregnancy, because that can have an impact on the pregnancy as well as on the fetus. So depending upon the type of infection or what kind of infection it is, we do some test, like if the patient is having urinary infection, which is very common during pregnancy. So if she is suffering from any UTI, then with the help of the urine test, we decide and we give the antibiotic course if required. And we only give those which are pregnancy safe antibiotics, because UTI itself can become complicated during pregnancy, which can land up in preterm labor pains also. So that is very essential, that what kind of infection is it, at what stage it is. It has to be treated that very time only,
Yeah,
so that your pregnancy is all safe.
yeah, that's a great information from you, ma'am. So tell us, ma'am, during the pregnancy period, the normal things which each and every woman face is very simple. They'll be having morning kind of sickness and fatigue and back pain. So tell us, how can we resolve all these kind of normal problems which they have in their daily life during the pregnancy periods, ma'am?
Okay, so morning sickness is very common during pregnancy, especially in the first trimester of pregnancy. It means whenever she gets up, she will have this nausea. She can even puke immediately after she gets up, or whenever she brush her teeth, she will have that sensation of vomiting. So whenever the lady has these issues, we have some supplements which we can give to her so that she can take it one night before, so that in the morning she will be better. So that is one thing. Second thing, throughout the day also we make sure we tell the women that you should have very small regular meals. Means every 1 to 1.5 hours she should eat something. She should not eat a lot of food at one time. Instead, she should take very small snacking type of meals throughout the day. This will help in preventing the acidity or the gastritis, which causes this lot of nausea. So this is one way. Second thing, she has to have a very good hydration throughout the day. She should drink lot of water. Even in sips she can take, because she will be feeling lot of nauseating, so she can't take lot of water at one go. So in sips she can take. Then she can have ginger or dry coconut in the mouth. She can keep it, and this will help in lubricating her mouth and will improve her morning sickness. So these are very small changes that she has to do in her daily routine, which will avoid this morning sickness. Second is the back pain, which is this is also very common. This is because of the posture we keep it during pregnancy. Normally, this back pain comes in the third trimester when the weight of the baby is more towards your back. And that is why you switch the spinal cord curve switches to the front. So during this time, we say to have a proper back support whenever you are sitting or doing your office work, and have do some light stretching yoga for the back. These are all the ways in which you till the delivery you can avoid all these issues, because even during the delivery process, the entire weight of all your pains and on of the baby is falls on your back. So your back needs to be strong so that you can bear that painful contractions, or you can bear that pain during your delivery journey. So these are the things which she has to do to avoid all these issues.
Of course, we were just talking about regular normal exercises and yoga even before. Like that's what
Yeah,
will
yeah,
be helping them for clearing this kind
yeah,
of back pain issues. So yeah, these are the
yeah.
normal kind of symptoms which each and every woman face during the pregnancy times. Also, tell us what are the red flags should we actually concentrate so that we can actually differentiate this is not the normal kind of pregnancy symptoms and these are the red flags, so that we can take some precautions accordingly. So tell us about the red flags which we should not see during the pregnancy times, ma'am.
The red flags are like if she's having heavy bleeding, then she should immediately report to the hospital, or she's having very severe backache or severe abdominal pain. Second thing, if she's having excessive vomiting, this will cause extreme dehydration. That can also will have a effect on the baby and on your pregnancy. Then if she in the later part of the pregnancy, if she's not feeling fetal movements, so then she should report and head towards the hospital immediately. So these are the some basic, these are the some red flag signs that the we tell from the very beginning to the women, so that she can immediately head to the hospital.
Yeah, that's the thing which we should actually make some concentration. And also, people will be having some mood swings, some kind of depression, anxiety, because we are humans. We do have actually these kind of things. But during pregnancy times, tell us how can we manage these kind of mood swings, anxiety, and depression. So tell us all about that now.
The mood swings, anxiety, depression, why these are very common during pregnancies are because of the hormonal changes which our body goes through the pregnancy. The one of the most common hormone which causes all these symptoms are the progesterone hormone. Now, this progesterone hormone is at its peak during the pregnancy because it supports your uterus and your pregnancy. So during the and we cannot stop this hormone to go down. So the reason behind these are because of the progesterone levels that changes during the pregnancy. Now, how we can avoid these is that we tell the patient to communicate with your family, with your friends, and in each visit also we make sure that the any issues the if the woman is facing or she's too depressed or her moods are low, then we make sure that we refer to the proper counseling centers so that they can guide and will help the women in overcoming these issues during the pregnancy. So the best is the support which she gets from the husband and from her near dears and the family and the friends. So that is the best way she can overcome these issues during pregnancies.
Of course, we were just talking even before that actually the partner should have a proper kind of healthy relationship to support during the pregnancy times to avoid this kind of mood swings, anxiety, depression.
Yeah. So nowadays that line has changed that I am pregnant. Now it has become we are pregnant. So that we stands for the mother as well as the father, that the father also goes through that 9 months pregnancy journey along with the mother.
So that's a great support which each and every woman expects during this kind of pregnancy times, I understand. So yeah, tell us any tips for better sleep and how to avoid weight gain during pregnancy times, because during this pregnancy times, people will be having a lot of headaches. They'll not be able to sleep during the night time and they'll be having a lot of issues. So tell us any tips so that they'll be having a better sleep so that they can be having a very good day to take care of the baby the next day. So tell us about it now.
Okay, so during pregnancy, rest is very important because the women generally feels lot of fatigue and tiredness during pregnancy, and rest better. She should have a very good routine sleep schedule. In the afternoon, also we make sure that we tell our women that if you're not working or if you can take break in your office work schedule also, take a small power nap or a half an hour to 1 hour break. So in the afternoon also just rest for some time. And in the night, we tell them that you should avoid screens during night. Okay. And instead you start reading some kind of books. Do light meditation at night if you feel that you're not sleeping well. These are the ways in which you can have a good night's sleep in the night. Then have if then don't eat too much of oily or extreme spicy food, especially in the night, because that can cause severe heartburn or severe gastritis. So these are small changes in which she can do, and throughout the pregnancy she can have this better sleep. And second thing, yeah, and in terms of weight gain, we make sure and see whenever a woman becomes pregnant, she should have a normal BMI when she conceives. So, especially in the preconception phase, if an overweight woman comes, we make sure and we tell her that you need to control your weight now, so that during the pregnancy you are allowed to gain weight. Otherwise, the weight gain which we say in a normal healthy woman in pregnancy is around 11 to 12 kgs. But if she's already overweight, she will not be allowed to gain weight. She will only be gaining weight that which is the amount of the baby which and the uterus and all the entire that her reproductive system, that much of weight she can gain. So in the preconception phase, that is also one of the things which we say to have a healthy weight, so that in pregnancy she can be allowed to gain weight and she can eat some of the extra sweet things if she is craving for that. So that is the thing. So even in pregnancy, we say don't go to eat too much of sugary. Even if you are craving a lot, just avoid and substitute with some healthy items instead of going for that sugar and processed refined sugars or any processed food. So these are the ways in which you can have a healthy pregnancy as well as a healthy baby.
Of course, these are the battles which we face because during the pregnancy times, people tell eat whatever you wish, but there's a certain limit which we should look for. But as per
Yeah.
your guidance, I think they can actually gain a better vision about the intake of food. I don't understand, ma'am. So yeah, we have discussed a lot about pregnancy tips, and also tell us, ma'am, how can we find the sign of labor pain? Like what time should we actually rush to hospital? It's not like we should rush to hospital at the last minute, but tell us any signs that we should look for during pregnancy time so that we can actually reach the hospital in prayer at the right time. So tell us about that kind of steps we should take during those emergency kind of periods, ma'am.
Okay, so your body generally starts preparing for the labor when you enter the third trimester, that is from the 7th month. During these 7th and 8th months, you have these false labor pain or painless contraction, which we call as Braxton Hicks contraction. These contractions slowly and slowly add up and becomes regular painful contraction at the end of your 9th month, that is near to your due date. So when your contractions are regular and they are painful, these contractions we call it as true labor pain. Along with these contractions, if you have like a watery discharge, a lot of watery discharge comes out, or there is a bloody mixed discharge, or you start feeling that the contractions are too painful that you are not able to sit or not able to rest, and then you need to report to the hospital. Second thing is, if it at any part of time you feel that your movements of baby movements have reduced, that is also an alarming sign, and you need to head to the hospital to go for a checkup for your pregnancy, and whether the mouth of the uterus has been opened, whether you are into the labor process or not. So these are the changes which we counsel the patient once they enter the 9th month, that whenever you have any signs, you should report at any time to the hospital.
Also, tell us, ma'am, about the pain management process because a lot of people will be having a lot of pain during this period. And also,
Yeah.
tell us during this kind of period, I mean, periods, are partners allowed to have a kind of in the room for a as a birth companion? And also, tell us how do we prepare for a C-section and also for a normal delivery? So, tell us all about it, ma'am.
Okay, now that painless delivery has become quite a fashion nowadays. So many patients, they come and they from the first visit they are keen on having a painless delivery. So now there are many options available. The first is that we generally advise them, if you want a painless delivery, we offer them epidural analgesia. In this, there is a small needle is given at the back of your into your spinal cord, through that the painless medications are entered. So about 70 to 80% of your pain, you become pain free during your labor process. So this is the one of the commonest way in which we give you the painless delivery. Then there are some medications also we offer during your labor process, which relaxes your uterus, and these also helps in you having a painless delivery. So third is now the water births, which are very common in the western side. Now in India also, some of the hospitals like Apollo and all, they are promoting these water births. So in water also, you don't feel that much of pain, that much of contractions. So these are some of the ways in which we offer women to have a painless delivery. Then, in talking about the companion, yeah, some hospitals allow the companion like a mother or the husband into the labor room, but it is not very common in all hospitals in India. So it depends upon the hospital policy, but either the husband or the mother, if to give support, emotional support to the women, to the mother, sometimes we allow them to enter the labor room. Then, how you can prepare your body for the normal delivery or a C-section? See, C-sections are generally done wherever they are indicated. There should be some medical indication, then only we advise a cesarean delivery. We generally, from the first antenatal visit till the last antenatal visit, we generally prefer to have a normal delivery because the recovery is fast, you get discharged early. So there are many advantages of the normal delivery. So during your 9 months pregnancy, we advise our patients to be active. Why we keep on saying to have to do the exercise, to do yogas, to do some pelvic exercise. These are only so that your during near your due date, your normal delivery process becomes easy. In the third trimester, we advise our patients to go for some pelvic floor muscles exercise. This will help in strengthening your pelvic muscles, which will have lot of pressure during your labor process. So in the third trimester, we advise them like simple home work, like household work in mopping and cleaning. These are the ways in which they have they strengthen their pelvic floor muscles. So these are the ways in which they can have a normal delivery, and it becomes easy for them also.
That's a wonderful information from you, ma'am. Also, tell us the most common kind of fear is during pregnancy times can be travel. So, if we do, what are the precautions should we take? So, tell us about it, ma'am.
Okay. Yeah, you can travel during pregnancy, especially in the second trimester, if all your ultrasounds and are all fine. So, pregnancy is not a contraindication to traveling. You can easily travel. Generally, near to your due date, we avoid traveling because due to the pressure changes, sometimes you start feeling pains and you can land up in delivery. So that is one of the reason in the near to the due date we avoid. Second thing, avoid very long traveling because in case you land up in emergency, then there will be no stops and all, and it will be difficult for you. During traveling, we advise patients to have eat properly. Don't go for very long fastings. Hydrate yourself. Then get up after brace like 1 to 2 hours. You get up and go for some walk because there is always a risk of blood clotting during pregnancy because of thickening of the blood happens during pregnancy because the blood supply to the fetus it has to go. So this makes the pregnancy little high risk towards having clots, which we call thrombosis during the pregnancy. So these things can be avoided if you maintain hydration and you walk so that the blood flow in your legs happen. The blood moves up and down. So during the traveling, we say take all these kind of precautions. So the traveling is very much safe in pregnancy.
So, also, most people they go for IVF. So, tell us, ma'am, what are the chances that we can get a success rate in IVF, and also tell us is IVF process is very much painful. So tell us about that process, ma'am.
Now, IVF is not a painful process. If any patient, whoever comes to my OPD, the first question in their mind is whether it is painful or no, or not. It is not at all painful. The injections which we give you, the hormonal injection, which are the major part of the entire IVF process, they are generally, the needles are generally very small. It's like an insulin injection. So even, and they are very patient friendly injections. The patient itself can take. They are given under the skin, subcutaneous. So they are not painful. Second thing, the pickup, the ovum pickup, which you say, or the egg retrieval process. That process is done under anesthesia. So it is a very short process. You don't know it's the entire, you are given general anesthesia. So you are unconscious and you don't know anything about. After the process also, you don't feel much pain. Mild abdominal cramps can be there, but these are easily manageable with oral painkillers. And the embryo transfer process is altogether painless. We generally do it without anesthesia, and you are discharged within half an hour after the process. So the entire IVF process is very painless.
Yeah, and also people will
Okay.
be worried about how long does this IVF cycle takes, and tell us about the number of cycles it actually takes and the time period from the beginning to the end. Tell us about it, ma'am.
Okay. Now, an IVF cycle starts from your menstrual cycle. Generally, it starts from your day 2 of your periods. From day 2, you get your daily hormonal injections. Okay. In between these injections, we do the ultrasound to monitor your growth of the eggs. This process of hormonal injection takes around 10 to 12 days. Once your eggs are big enough to a size which we want, which are to a mature size, we retrieve these eggs under anesthesia, which is a very 10 minutes process. After the egg retrieval, your partner gives us the semen sample, and with the help of the sperms, we fertilize each single egg. This process is called ICSI, intracytoplasmic sperm injection. Single egg, one sperm is injected with the help of a needle. So that process takes place in the IVF lab. Okay. And then followed by the embryo growth, which takes place 5 days. So once your embryo reaches to a stage which is called a blastocyst stage, that is a day 5 embryo, we freeze it, or in cases of fresh cycle, we do transfer it after 5 days of egg retrieval. So your IVF cycle generally takes either 1 month to 1.5 months, depending upon what type of embryo transfer we are going. If we are going planning a fresh embryo transfer, your IVF cycle completes within a 1 month. But if we are planning a frozen embryo transfer, then we freeze your embryos at the blastocyst stage and then transfer in the next month when you get your periods. So it takes around 4 to 6 weeks. So that is one IVF cycle.
So also people will be worried about what is the most common reason for infertility in men and women. So tell us, how can we actually control all these kind of things and make ourselves healthy, ma'am?
Nowadays, we are seeing a lot of infertility patients, even at the younger age. The most common reason for infertility we are finding is ovulation disorders. Means the women are not ovulating. They are having irregular cycles. It could be either because of any hormonal imbalance like PCOS, thyroid disorders, or there could be some issues like endometriosis. Sometimes women have blocked tubes. When your fallopian tubes are blocked, then you cannot conceive. So these are the indications of IVF from the female side. From the male side, because of their sedentary lifestyle, have eating lot of junk food, processed food, keeping the laptops on your lap, they are also facing infertility issue in terms of poor sperm count, poor sperm motility, and poor DNA fragmentation. So from the male side, these are the reasons why we offered IVF to these patients. Okay. Now the second thing is, now you were asking about the IVF success rate also. Yes. Now even in the best hands, IVF success rate is around 40 to 60%. Even when we do all the best things, IVF never gives you a guarantee of 100%. So some people, they conceive within one cycle. With the one cycle they conceive. But some people, yeah, definitely some couples, they may require 2 cycles or even 3 cycles, and then they get successful pregnancy. So whenever there is an IVF failure, definitely there is a lot of emotional breakdown and all. We have, at this point of time, we as doctors, we as medical healthcare professionals, we offer them support, we offer them counseling, that this is not the end of your journey. IVF is not just a single attempt. You need to understand there are reasons behind each IVF failure. So then we properly scrutinize the entire things, where what thing happened, why this IVF cycle failed, so that the next treatment protocol is more customized, is more personalized, so that they get a healthy and a successful pregnancy next time.
And also, people will be worried about there will be some kind of unexplained kind of infertility
Exactly. Yeah.
kind of things, because as you said, because of certain things, men face a lot of troubles because of sedentary lifestyle and other kind of things. So on the other hand, there will be some kind of unexplained kind of things. So tell us, what do you want to tell regarding these kind of things, about the way you approach? Tell us all about it now.
Okay. Now, in unexplained infertility, it means that all your tests are normal. Like in terms of female, if we ask, the blood test, the AMH is normal, her tubes are all fine, her uterus is all fine. And in male side, his semen analysis is fine. But still, there are some unknown factors which we cannot test, which in these couple land up in unexplained infertility. In these cases, there are treatment which are offered to them, like ovulation induction along with IUI. We offer them, and these treatment, they give very good result in these patients. In case IUI is not successful, then we offer them IVF. So unexplained, even in unexplained infertility, successful pregnancy can happen very easily.
So also tell us, ma'am, how does this hormonal imbalance affects the IVF success rates? Because as we discussed before, during pregnancy times, hormonal balance is a very vital must. So tell us, how
Yeah.
does this plays a vital part in kind of making the IVF treatment success? And if not, what will be the consequences? Tell us about it, ma'am.
Yeah, even in IVF, hormonal imbalance badly affects the results, because if your hormones are not in well control, then the treatment or the injections what we offer, they will not have that effect like if your hormones are balanced. So even before starting any IVF cycle, we do all the hormones baseline check, like your thyroids are checked, your prolactin levels are checked, your sugars are checked, sometimes your estrogen and LH levels, these are also checked, to make sure that everything are well controlled, and then we start your IVF. In case anything is abnormal, we take a break, we control these hormones first, we balance them, and then start the IVF cycle, so that you also get the maximum results from your treatment.
So also we should have a lot of support from our partner during the IVF
Exactly.
treatments. So tell us, in what way can a partner support us during this kind of IVF treatments, ma'am?
See, during IVF is very emotionally loaded process. Throughout the time, the couple, the women they are facing some emotional breakdown. So throughout this journey, we make sure that from our side also, we make sure that we give as much of emotional support to them. In mostly in all IVF centers, we have a counselor available. So throughout, whenever the patient visits, We make sure that our staff greets them well. The counselor, each time the counselor also asks them, if you, ma'am, if you have any problem, because these hormonal injection, they causes lot of mood swings, because these are very high dose of injections. So at this point of time, we make sure that husband supports her wife well, shares the responsibility, shares the emotional burden well, and if they have any kinds of doubt, we make sure that we as doctors also help them clearing all kinds of doubts. So in this way, if they will share their responsibilities together, I think their journey will become much better.
Okay, so also tell us, ma'am, what are the options if this IVF cycle fails? So tell us what should we do after this kind of things happen, ma'am?
See, an IVF, a failure of an IVF cycle depends on many factors, like how was the egg quality, how was the sperm quality, then the how was your embryo which was made, how was that, then other factors like whether there was any issue in the uterus which affected implantation, like if there was any fibroids, any polyps which were there, which affects the implantation. So whenever we have an IVF failure, we check all these things. In case the embryo was made, the quality of the embryo was very poor, then we advise, then we explain the reason behind why it happened. It could be a possibility that that embryo which was formed may not be genetically healthy. That is why it didn't implant it. So the next time we offer them some genetic test to before their second attempt. So in case the wife, her age is advanced, like if she's in her 40s or in very late 30s, in that case also their egg quality will decline very badly. So in these cases, if we know that the egg quality is very poor, then the option that we can offer to the women are to go for a donor egg, to replace your egg with a younger lady's egg. So these are some of the ways in which we try to manage the IVF failure cycles, so that next time they conceive and have a successful pregnancy.
So also tell us, ma'am, how does this PCOS affect this fertility process, and what treatments actually help ovulation in PCOS, ma'am?
Okay. Now, PCOS, I have discussed before also. In PCOS, the issue is that they don't ovulate well, and that is the reason they don't conceive easily. And 50% of the PCOS, need some kind of fertility treatment, because ovulation is not there. In PCOS, whenever a PCOS enters to my clinic, we say, even if you to have a very active lifestyle, even if you are not losing weight. In PCOS, the problem is that they don't ovulate. So the best way to treat their fertility issues is we give them ovulation induction drugs, which help them ovulate, and then they can plan their cycles, like either they go for natural dry, or whenever there is ovulation we can proceed with the IUI. So in this way, in PCOS also, fertility issues can be easily managed. Not all PCO need IVF all the time. They can be easily managed with IUI or even normal try.
That's a great thing, ma'am. So yeah, we have discussed a lot about the pregnancy time things, what should we do, what not should be done, and also
Yeah.
regarding IVF, we had a lot of information via this interview from you, ma'am. So yes. So one final question for this interview is very simple. Via this interview, if you want to convey any kind of message to the people, what would be that one message that we would like to convey to the audience, whomever watching this interview right now, ma'am?
Okay. So, me being an obstetrician and a fertility specialist, I would advise all the couples planning from the preconception phase to your fertility treatment to your pregnancy journey. Just be together. Just be a support to and give both you as an emotional support to each other, because this really helps in having a positive attitude towards your treatment also. And throughout your journey, just have a positive mindset. Whenever you are in doubt, you need to ask. Don't blame yourself. Don't regret that this is my problem. This is because of me. No, nothing is in your hand. Nothing is in your partner's hand. You need to be together, and you need to just believe in your healthcare team also. So believe in your doctor and have a positive mindset. I think you will achieve your dreams very easily.
That's a very wonderful message. Of course, any process actually requires some kind of mutual support from each other. So, coming to these kind of things, of course, we require a lot of attention, support, physically and mentally, so that we'll be able to have a very good and healthy life ahead. So, thank you
Yeah.
once again for accepting me to host this interview, ma'am. Again, I'm just telling you, had a very wonderful conversation related to pregnancy and IVF kind of things. And people who are watching this interview right now, please do subscribe to Women Today YouTube channel and click on the bell icon
Yeah.
so that you can receive notifications whenever I do post new videos regarding women entrepreneurs and working women across different cities in India and also across different countries in the world. So today's our guest is from Delhi, Noida. Her name is Dr. Sakshi Chopra. She is a gynecologist, and we had discussed a lot about pregnancy and IVF tips over here in this interview. So today's your host is Krishna, hosting this Women Today YouTube channel. So thank you once again, Dr. Sakshi Chopra, ma'am, for having a wonderful
Thank you.
interview. So good evening, ma'am. Have a nice day.
Thank you. Thank you.
Thank you, ma'am.